Hello friends, this is your surgery ka dost DRM Dr. Rakesh Mittal, and today's topic is stomach. There are 4 5 topics in stomach which are very commonly asked in all the exams. One is obviously the gastric cancer, the gastric lymphoma, the GIST, gastrointestinal stromal tumor. There are 5 6 questions. Amongst the benign ones, peptic ulcers, obviously the complications, the surgeries, the complications of surgery. And a few small topics include like certain conditions like Menetrius disease, right? Okay, this is, I think last 10 years, I'm seeing this question very commonly being asked in different forms. The acid-based disturbance seen in pyloric obstruction. More The changes are more pronounced in idiopathic or congenital. That's called CHPS or IHPS. Idiopathic or congenital hypertrophic pyloric stenosis. Can be seen in adult also, but adults it's less pronounced. You may not see all the changes. Kids are prone and they are more pronounced. Now you should know the complete list of it. Now pyloric stenosis means there is a block here, gastric outlet obstruction. Okay, there is congenital hypertrophy of the pyloric muscles, that olive shaped mass. There are other things. We are not going to discuss the whole of CHPS, right? Now, stomach, all of you know, stomach has acid, hydrochloric acid, it's HCl. Stomach has potassium, stomach has sodium. So, if there is a block here, all this will be vomited out. So, loss of acid, that is loss of hydrogen, makes it alkalosis. And since the cause is metabolic, it is metabolic alkalosis. Easy. Loss of potassium, so it is hypokalemia. Loss of chloride, so this is hypochloremia. So metabolic alkalosis, hypokalemia, hypochloremia. There is one more to this. Now the compensate, all of you know, you must have read fluids and electrolytes in details. The compensations happen at one, lungs level, respiratory compensation, and second is kidneys. Now in this situation, kidneys, now potassium is lost, hydrogen is lost. Now kidney has to compensate for both of these, but there is mutual at kidney level. The kidney can save only one. There is a mutual potassium hydrogen exchange in kidneys. You must have read. So what happens is hydrogen ions are further lost in urine. Kidney saves more potassium. Hydrogen ions are lost. So this is paradoxical. Why paradoxical? Because obviously we are losing hydrogen ions from the stomach, we are losing acid from the stomach, and kidneys should save acid, but now kidneys are also losing acid. So this is called paradoxical aciduria, acid being excreted in the urine paradoxically. So this is the complete list of changes that happens in pyloric stenosis, mainly the congenital hypertrophic pyloric stenosis. Right? Done. Okay. Which of the following types of gastritis is associated with pernicious edema? So, if we have type A gastritis and type B gastritis. So, let us first discuss the type B. The easiest way to remember is, though many of you must be knowing it, the name itself, A for autoimmune and B for bacterial. So that's just one word. This will explain everything. I'll show you how. Autoimmune. So first step is autoantibodies against the parietal cells. So that's question number 1. Autoantibodies against the parietal cells. Now, what do parietal cells secrete? Two things. One is acid and second is Cassel's factor, intrinsic factor of Cassel. So when parietal cells are destroyed, so no acid, no intrinsic factor of Cassel. No acid, that means hypo or achlorhydria. So that's another question. So that's one, that's second. Hypochlorhydria, loss of acid, achlorhydria. Okay. So since there is no acid, so no peptic ulcer disease. That's another question. You don't see ulcers in type A gastritis because there is no acid. No Cassel's factor, no intrinsic factor, so vitamin B12 deficiency. So these patients will have pernicious anemia. So that's a question which we are discussing. Which of the following types of gastritis? So it's a type A gastritis. So you should know. So just remember one word that will lead you to all the possibilities, all the further. So easy to remember, so easy. Okay, just know your basics, basic physiology, basic anatomy. So pernicious anemia has happened. Okay, now further the story doesn't stop here. Hypochlorhydria, achlorhydria will stimulate G cells in the stomach that secretes gastrin. So less acid, more gastrin. Compensation. So hypergastrinemia. That's another question. Hypergastrinemia, excess of gastrin secretion. But gastrin has multiple functions, basic physiology. Gastrin acts on parietal cells to produce acid, but parietal cells are already destroyed. So gastrin has another function, hypertrophy of mucosa. Gastrin also acts on mucosa, epithelial cells, causing hypertrophy and hyperplasia. And this can lead to the cancer. So that's another question. This can lead to cancer. Done. That's the complete story of type A. Now type B is bacterial. All of you know which bacteria. Question number 1. H. pylori. H. pylori, you know, has obligate urease activity and cytotoxins CAG-A, VAC-A. Cytotoxins are responsible for cancers in the stomach, even the gastric lymphoma, gastric cancer. Obligate urease, you know, will split urea into ammonia. Ammonia will create alkaline environment. And alkaline environment will again stimulate G cells to compensate, to produce acid to neutralize alkalinity. G cells. So again hypergastrinemia. But here the effect will be different. Because in type A, what is the difference? Both ultimately leads to hypergastrinemia. But here there are no parietal cells. Type B, parietal cells are there. So excess of gastrin will act on parietal cells and will produce acid. So this will have hyperchlorhydria. See the difference. This one had hypo or achlorhydria. This one has. So another question. See the contrast. Some common, some